Welcome to Frost & Sullivan's Growth Podcast. This series brings together key insights from our research, growth analyses, and thought leadership, highlighting the strategic imperatives shaping industries, technologies, and markets worldwide. In this episode, we focus on behavioral health management and the digital solutions transforming how care is accessed, delivered, and managed, distilling essential perspectives to help teams understand what is changing, why it matters, and how organizations can align strategy with emerging growth priorities. Demand for mental health services continues to rise, yet traditional care models are struggling to keep pace. What's driving the need for a different approach?
The challenge is not simply rising demand. Workforce shortages and limited access to timely support are making it difficult for traditional session-based models to meet the full range of behavioral health needs. Historically, care has often been symptom-driven and focused on individual treatment episodes. But behavioral health needs don't necessarily begin and end with a clinical appointment. Employers, payers, and health systems are increasingly looking for ways to support prevention, early intervention, treatment, follow-up, and relapse management through a more connected model. That's where digital health platforms are expanding their role. Telebehavioral care remains important, but platforms are increasingly combining care navigation, digital therapeutics, workflow automation, monitoring, and outcome tracking.
AI is becoming part of healthcare conversations across the board. Where is it beginning to make a practical difference in behavioral health?
AI can help extend support by identifying needs earlier, improving triage, personalizing interventions, and supporting patient engagement. Current applications include risk assessment, care routing, and treatment personalization. Emerging applications include clinical decision support, predictive analytics, and relapse detection. But it's important to distinguish between extending care and replacing clinicians. AI is not replacing therapists, psychiatric diagnosis, or human oversight in behavioral health care. Adoption is also moving carefully because behavioral health involves sensitive data and requires strong clinical evidence, appropriate governance, and stakeholder trust.
What is changing in the way behavioral health solutions are being purchased and delivered?
Buyers are increasingly looking beyond isolated consumer applications. A platform that only provides one service may not address the broader journey, from identifying a need and navigating an individual to the right service through treatment, monitoring, and long-term support. This is increasing interest in subscription, bundled, and hybrid care models that bring multiple forms of support into a more connected experience. For employers and payers, integration also makes it easier to evaluate outcomes. They want to understand not only whether people are using a service, but whether it is improving engagement, supporting health outcomes, and potentially affecting productivity and healthcare costs. Digital assessments, automated triage, and care navigation are also helping reduce the friction created by fragmented referrals and disconnected systems.
If the demand is there and the technology is advancing, what is still slowing wider adoption?
Several barriers remain. First, behavioral health solutions often face strict regulatory and evidence requirements, particularly when companies move into more clinically focused applications. Reimbursement can also be uneven, making it harder to scale across different regions, healthcare systems, and buyer groups. Integration is another major challenge. Connecting digital platforms with health records, payer systems, and employer programs can add cost and complexity. Then there is workforce readiness. Digital tools need to fit into clinical workflows, and adoption can vary significantly across providers. Finally, the competitive environment is becoming more demanding. Buyers are scrutinizing pricing and outcomes more closely, which is increasing pressure on smaller vendors and contributing to industry consolidation.
Looking ahead, which areas offer the strongest opportunities for digital behavioral health companies?
One important area is preventive care and longevity. Behavioral health support is beginning earlier, before individuals reach a point of crisis. Areas such as stress, sleep, emotional resilience, and cognitive health are becoming part of broader primary care, virtual care, and workplace health strategies. A second opportunity is neurodivergence and brain health. Digital assessments, behavioral support tools, and executive function coaching can provide ongoing support for ADHD, autism, and other cognitive differences across healthcare, education, and workplace settings. The broader opportunity is to build platforms that support people across different stages of need, rather than focusing on a single consultation or intervention.
The behavioral health landscape is moving beyond the traditional model of episodic treatment. Digital platforms are creating new ways to identify needs earlier, simplify access, extend support between clinical interactions, and measure outcomes over time. But the next phase of growth will require more than technology alone. Companies will need to demonstrate clinical value, integrate with existing healthcare systems, protect sensitive data, and work alongside, not in place of, clinical professionals. As enterprise buyers become more focused on measurable outcomes, the companies best positioned for long-term growth will be those that can connect access, intervention, analytics, and ongoing management into a scalable and coordinated model of care. That's all for this episode of Frost & Sullivan's Growth Podcast. For deeper analysis, research insights, and strategic frameworks shaping future growth, explore our studies and resources at frost.com or reach out to our team at hello@frost.com. We'll be back soon with more perspectives to help you stay clear-headed and growth-ready.